I'm Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client, Cassandra, is being treated whole body. She had a couple of severe falls and a couple of severe motor vehicle accidents. And part of her presentation is upper cervical pain. And you have a sense that things aren't right there?
Yeah.
What does it feel like to you?
It feels like something's stuck, and I get a lot of pressure. I feel like it's like needs to lay. I say it's not pressure, but a lot of congestion. I call it congestion.
Yeah.
Yeah.
And it's in your upper cervical. You use the
Yeah.
word occiput.
Yeah. Okay. Yeah.
Yeah.
Mm-hmm.
Very good.
Mm-hmm.
So in testing her mobility in the upper cervical spine, I come onto the front of the mastoid on both sides, and I'm able to impart a very gentle spring. So her occiput has a little bit of rotation, and that comes free and easy. And then I come underneath, and I can side bend your occiput with a contact on the mastoid. Okay? But if I stay right there and contact the transverse process of C1, now I'm trying to shear it to the left, and I'm trying to shear it to the right with a reasonable amount of force. There's no give.
Yeah.
If I come to C2 on the transverse process, look how free it moves, and that's with pressure through my finger.
Wow.
Very free and easy movement. If I come underneath C1 and I try and rotate it left and try and rotate it right, that doesn't move. If I come down to C2, boom, very free and easy movement. Okay? If I try and traction, and my contact is here, and this is very important. If you're trying to test traction at the upper cervical joints, which includes occipito-atlantal joints and the atlas axis or C1, C2 joint, your contact must be in front of the ear, because those joints are right below the ear, whereas the rest of the cervical joints, mid and lower cervical spine, are in the posterior part of the neck. So my contact is with the palm of my hand right here. And so I'm trying to traction your body, and there's no give. You're very compressed. Okay?
Yeah.
In neutral, there's no mobility. Now, let's put you in flexion. So you're in 10 to 15 degrees of flexion. There's no give. There's no give. Okay? Now, if I put you in extension, now you have mobility. I can see your whole body move. I can see your feet move up and down. And this is a small amount of force. So I can take up the slack in the upper cervical spine, and then I can traction, and then your whole body moves. Okay? So we want to restore normal traction, mobility in neutral and in slight flexion, because most of us walking around the planet have that motion.
And so that's why it feels so congested up there. Like I have that kind of pressure, but like I said, I call it congestion. And I like go to the chiropractor and get it, they crack it, but you know, it's still, then it doesn't take very long for it to go. They don't test that it moves other than the occiput probably.
Yeah, so they don't test this manner, they don't use this manner of testing. Yeah. I hear a lot of that. I hear that, that's what I hear.
Yeah.
So what I want to do is treat you in a direction that has mobility but close to the restriction. So I'm going to bring you up to only about 5 degrees of extension.
Okay.
And in that position, you're tight. Okay, I can actually take up the slack, but once I take up the slack, then I can't spring it. So this is a good direction. We're just really close to the restriction. And I don't like treating next at end range. I don't want to, extend you all the way back. I don't like doing that. I like treating as close to the restriction as we can. And I'm going to do this.
Can relax.
Yeah, so I'm going to do this for 5 minutes.
Okay.
I'm going to take up the slack, which we can do that. We can take up the slack. We just can't you know, we just can't spring in this position. So I'll take up the slack and maintain that for 5 minutes, and then we'll test everything again and see how you feel.
Okay.
So I'll stop filming now, and we
Okay.
will film after the treatment.
Okay, great.